Assalamu alaikum, the communication day. Your role is senior house officer in the general medical clinic. You will sit with Miss Safa Said, suffered symptoms of irritable bowel syndrome since 15 years. Intermittent abdominal discomfort, bloating, and loose motion for her symptoms, and her symptoms are getting worse since 8 months because of domestic stress. Her GP started her on antispasmodic and antidiarrheal medication, but that didn't help. Your consultant assessed her 8 weeks ago and requested investigation. All investigation came as normal, along with the sigmoidoscopy, also normal. Your consultant is sure about the diagnosis of irritable bowel syndrome and suggested to start her on amitriptyline. Please sit with Ms. Safa Said and explain the management plan. Can start in seconds after sharing the timer. I remind you until 2 minutes left, okay?
Okay.
Okay. You can start right now. Here you go.
Okay. Okay. Hello, I am Dr. Ghanem, doctor in clinic today. May I confirm you are Miss Safa Said, 32 years old?
Yes, doctor. Yes, I am.
Hello, Miss Safa. I'm here to discuss issues related to your health condition. Is okay with you?
Yes, doctor. Yes.
Okay. Before we start, if you want anyone to attend the meeting with us, feel free to do that. Okay.
Actually, doctor, I was expecting the meeting to be with your consultant today.
Okay. Okay. You have any? Do you mind if you do the meeting with me?
It's okay, doctor. Okay.
Okay. I'm so sorry because there were urgent situation, so he couldn't be here. Okay.
Okay.
Okay. Okay. I will answer you all your concern, and please, if you have any concern or inquiry, please ask me. Okay.
I will do, doctor. Okay. Thank you.
Okay. So before we start to be in the same page, can you please tell me how do you know about your health condition?
Yes, doctor. Actually, it's been ongoing for 15 years now, and nobody got my diagnosis yet. So I have been experiencing abdominal discomfort, loose motions, bloating for long time, and I have been referred by my GP to you. I met the consultant a couple of weeks ago, and he did investigations, and I am here today because. I supposed to meet him to discuss the result of my investigations.
Okay, okay. And what are your expectation about the results?
Actually, doctor, I'm really worried because my symptoms are getting worse over the last 8 months. So I'm really worried. I just wanted to find out what's going on with me.
Okay, I'm so sorry for your suffering. Okay, I can feel how difficulty you have been through. Okay, that you have done this test result, which was a blood test and also camera scanning. Okay, and these test results are with me now.
Mm-hmm.
Okay,
Mm-hmm.
and it is good news.
Mm-hmm.
Okay, it revealed that you have something which is not so dangerous. It is called irritable bowel syndrome. Do you know about it?
Actually, doctor, yes, my GB, I have been seeing my GB for the last years, and he keeps telling that I have irritable bowel syndrome, but I doubt it, doctor.
Okay, now that this results confirms that this is irritable bowel syndrome. Do you know about this condition?
I'm happy to hear from you.
Okay, okay. This condition, it is the symptoms that you have, which are the abdominal pain, discomfort, also, and bloating and loose motion. All these symptoms
Mm-hmm.
occur because of there is some like a problem in our body, and this
Mm-hmm.
problem is aggravated by stresses
Mm-hmm.
maybe that we have been through. Do you have any kind of stress in your life?
Yes, doctor. Actually, I has been like in a big conflict with my husband, and we like break up recently. But how this can give me all these symptoms. It's
Correct. I'm
ongoing
so
since
sorry.
before that event.
Okay, okay, okay. I'm so sorry for what you're suffering,
Mhm,
and we are here to help you. Okay,
mhm,
this condition, it is like our brain translate this
mhm,
these stresses or these abnormality in our social life into physical symptoms
mhm.
that happen. It is like a problem in the function of our body, and not problem in the structure or the building of our body.
Mhm,
You getting me? It is like no really no problem in the structure of the cells, but it is a problem in the function of the cells.
mhm, mhm, mhm.
So
Okay.
causing these symptoms. Okay.
Mhm, mhm, mhm. Okay, doctor. Okay, so uh, uh, how you will help me now, doctor?
Okay, okay, that's a good question. Okay, first we need to do some lifestyle modification. Okay,
Mhm, mhm,
we will involve the doctor, our consultant, and also maybe dietitian, maybe some other helping teams
mhm,
that can change your lifestyle, maybe
mhm.
by changing your diet, your regular diet, by decreasing caffeine, by decreasing. Do you smoke?
Just a little, yeah. I do smoke.
Okay, smoking can affect your condition very
Mhm,
badly, and I advise you to stop smoking. And if you need help,
mhm,
I can refer you to smoke drink limit.
mhm,
Okay?
mhm,
Do you
mhm.
drink alcohol?
And occasionally.
Okay, and this no binge drinking, right?
No, no.
Okay,
Yeah, no, a
okay.
couple of times, but not usually.
I advise you to moderate your alcohol because this also can affect your
Mhm,
condition specifically. Okay,
mhm, 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 mhm,
okay,
mhm,
and also to try to take some recreation, some vacation, some time with your family, sometimes with your friends. All this can help you, and
mhm,
also good sleep can help you. And okay, all these can help you. Also,
mhm.
our consultant decided to give you a medication which could help your condition very much, which is called amitriptyline. Do you know about it?
I'm a tryptophan doctor. Do you think
Yes.
I am mad or I'm inventing these symptoms? I know one of my friends, she's taking this medicine for depression.
Okay. Depression people are not mad, and not everyone take this medication is mad. And the
Mhm,
medication can have a lot of purposes,
mhm,
and they
mhm,
can be used for a lot of indications or uses in health condition. Okay, and in your condition, it will be with minimal dose that can improve your condition, improve your
mhm,
symptoms, and
mhm,
it is proved that it have a very good impact on your on the condition that you have, which is irritable bowel syndrome.
mhm, mhm.
Okay, and
Actually, mhm,
okay, okay,
yes.
tell me.
No, I'm listening.
Okay. This medication could help your condition beside this lifestyle modification, and also decreasing the symptoms that you have. Okay, but it is like other medication could have some side effects like dryness of the mouth, some GIT upset, some tummy upset, like feeling sick or feeling you need to vomiting. Okay, but this is our minimal and could not happen. It not happen to all people, to all person. Okay.
Mhm, mhm. Actually, I remember my friend mentioned that this medicine makes her sleepy and drowsy, and I don't know. I don't want to have such a complication, doctor, because I have a lot to do.
Okay, I can understand this. And as I discussed with you, that this medication will be given to you in the lowest effective dose. That will not cause any symptom like this. And if you have any symptom like this, we will monitor you and we will help you as soon as possible. Okay,
Mhm, mhm,
and also not all patients have the same response as each other. to the medication. They differ from one person to another. Okay, and
Two
also
minutes
according to
left.
the cause. Okay,
Mhm, mhm, mhm. And
okay,
you mentioned it, and it will gives me more discomfort. So, doctor, how you can help me? Because I'm really worried. I'm really bothered by my abdominal discomfort. And you mentioned this
okay.
medicine will make it more. Is that what
Yes,
you mean? Mm-hmm.
I understand this. No, it is these side effects or these unwanted effects of the medication. It occur with any medication, but
Mm-hmm.
it is not necessarily that every patient take this medication can have these side effects. And we
Mm-hmm.
will monitor you. And if you have any symptom, um, we can help as soon as possible.
Mm-hmm.
Okay.
Okay. So, doctor, can you please do camera test because I'm worried it might be cancer.
Okay, and I can see in your test that you have done this camera test, and
Mm-hmm.
it concluded that it is normal and no, nothing you
Mm-hmm.
have. But if you have any worrying symptoms, like maybe bleeding in back passage, or increasing in your symptom, flaring up of your symptoms
Mm-hmm.
suddenly, okay,
Mm-hmm.
or severe abdominal pain, you can come contact us and come to the hospital
Mm-hmm.
as soon as possible, and we will do tests to confirm about your diagnosis and see that if anything dangerous has happened.
Mm-hmm. 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 Okay, doctor.
Okay,
Okay. Yes. Yes, doctor.
so
Okay.
are you willing to take this medication?
Yes, doctor. I'm happy to try it. I tried a lot of medications, but I had never tried this one, so I'm happy to try it if you feel like it will help me.
That will be good, and it will help you, and
Mm-hmm.
also with this lifestyle modification will help you and
Mm-hmm.
will decrease your symptoms, and I'm sorry for what you are being through.
Mm-hmm.
So you have any other concern?
Okay, time is up.
Mm-hmm.
Okay.
Thank you.
Okay, Dr. Nagla, you can start to comment over the skills.
I first of all, I would like to say sorry to Dr. Sarah for being naughty patient. Actually, it's yeah. I attended this scenario before, and it was the person who's just like presenting it mentioned that it came like this in the exam. Like the patient, when you get and introduce yourself, it's just like she straight away mentioned that. Sorry, I was expecting my your consultant. Why you are here, doctor? So it's how it came in the exam, and
Okay.
yeah, and you responded very well to this concern, but he mentioned that in it's better to say I had a discussion with my consultant and I'm aware of your condition and I'm happy to have this meeting with you, and I'm happy to answer all your concerns. Actually, you did it, but you mentioned there is a very urgent condition and the consultant is an urgent condition. um Anyway, you responded well to this point.
Okay.
You explained the irritable bowel syndrome in a good way, yes, and you explored about the risk factor of stress without being judgmental towards the patient. I believe you did very well. Regarding the amitriptyline, the side effects of amitriptyline actually it causes constipation. Other than drowsiness, it causes constipation, so you can mention it as a benefit here. This medicine can cause constipation, and I can see you are more concerned about loose motions because it's mentioned that it is written loose motion in this scenario, just pointing towards the side effects of amitriptyline as constipation, which may be beneficial in your case. So you can use this as a convincing a tool for her to start it. And I was waiting to hear the advice regarding amitriptyline to be taken in early evening, so you will not wake up the patient. Usually advised to take the amitriptyline early in the evening, because it causes sleepiness and drowsiness, so it will help them with sleep, and they wake up in the morning without the side effects of being drowsy and sleepy. So this is the advice usually given with the start of amitriptyline is to be taken early in the afternoon, so early in the evening, so you will not exhibit the drowsiness. Um, Otherwise, I feel you did great. You did great.
Okay.
Mm-hmm.
Thank you.
Okay, let's go to the market from first of all the clinical communication, how she, the introduction, the way how she approached, she communicate, the approach, explaining any use of jargons. How
Um,
can you, yeah,
mhm. I didn't feel that she had any jargons. No.
yeah.
I
Okay,
feel yeah. I feel she did great.
okay, but I will add simple way to explain, Dr. Sarah. You
Okay.
try to explain the irritable bowel, but I think you went to a difficult explanation or uneasy to understand. So let's say simply, it's over reaction in the body to the surrounding stress or stressful condition. So the brain and the body react or overreact to the stimulating or triggers in the stressful, I mean, condition outside the body in the form of the symptom you have. That's it. Okay, you try to say there is something, there is nothing structural, which is also some jargon or organic cause. So easily overreaction or the brain overreact to the outside stimulator, which is stressful life condition for which you have these symptoms. Okay,
Okay.
in
I
the
have been
form of
searching
yeah.
for definition for this
Okay, yeah.
functional disorder, but I didn't find. So
Yeah, the
I
overreaction is the best way to say it. It's overreaction to the
okay.
stressful condition, and our brain overreact by giving these symptoms. The symptoms in the
Okay.
form of either a bloating or a diarrhea, constipation, even in the other functional disorder, whatever the type of it, you can say according to the symptom the patient present with. Simply, okay?
Okay. Okay.
Yeah, that's it. So but still you can get the full mark in the clinical communication. Let's go to the next, the clinical judgment. Okay, Dr. Najla,
Dr. Nagla.
clinical judgment.
Sorry, I was speaking
Should
when the mic is closed. So
no.
yeah, she did great. She explored the risk factors in a good way, as I mentioned, non-judgmental way,
Mhm.
and she relates the time of deterioration with the acute stresses that the patient was experiencing. So I feel like, and she was convincing to me, like in trying a new medicine. And when I raised the concern of is it for depression, and she answered this concern in a good way. So I feel I can give her like full mark.
Yeah, I
Thank you.
agree. Yeah, I agree too. And also for the side effect, explaining the task, she did everything related to the symptom and the task. I mean, the irritable bowel syndrome explanation. And the good thing in the start, she said, "Do you want me to explain more about it?" And also for the amitriptyline, did you hear about it, or have you ever heard about it? You want me to explain about it?
Mm-hmm.
And yeah, you can add only the route of ingestion. You can take it by mouth and once daily, and you will be followed. But for the reassurance, the follow up, the care, you will get the full mark. Yes, I agree.
Mm-hmm.
The concern as well, you can give.
Yeah, she answered my concern well, regarding the cancer. Yeah, because um, um, the whensoever there is a case of irritable bowel syndrome, the patient will raise the concern of having cancer and
Mhm.
requesting camera test. It is mentioned in the scenario, and I just wanted to make sure if she like mind it, she saw it, she's aware of the patient already, because the patient will keep asking for endoscopy to exclude cancer, and for
Mhm.
I mean camera test to exclude cancer. So yeah, I believe she answered it well.
Okay, so again, also satisfactory. But you can say also about the closure. I like when you tell her about the red flag. Add to the red flag blood via back passage or loss of weight or severe
Mhm.
tummy pain. Okay.
Mhm.
Yes.
Yeah, just add. You said all of them, but you didn't mention loss of weight. Because once
Yes.
you feel loss of weight, you might have what's called Cancer. It might be a cancer,
Cancer?
and this is her
Cancer?
concern. Yeah.
Yes.
Okay. For the welfare,
Yeah, she maintains the welfare of the patient. Yeah.
and
Uh,
yes,
Mm-hmm.
she respects her, and the alcohol. She give her advice about the alcohol,
Mm-hmm.
the smoking as well, taking
Mm-hmm.
rest, thinking about the sleep, the mood. Yeah, all these things might affect her condition.
Mm-hmm. Mm-hmm.
So, yes, you can get the full mark easily, Dr. Sarah, with good confidence. Okay, any comment from others?
okay.
Dr. Tabassum, yes, you can add also lymph node or lumps or bumps. Excellent. Yes, so the lumps or bumps, weight loss or high body temperature, it's a constitutional symptoms.
Mm-hmm.
Blood is in the store or blood in the, sorry for this, back passage, through your back passage. Thank you, Dr. Tabassum. Anyone had other comment, please? Want to say something for the functional disorder scenarios? So it can come as irritable bowel syndrome, it can come as tension headache, it can come as conversion disorder or sensation affection.
طيب, I have one question.
Yes.
If there was a concern that, doctor, I don't have a stressor, I'm doing fine, I'm handling my family very well. So, what will be your explanation for her uncontrolled symptoms? For, يعني I mean that she's not comfortable with the medication, not responding, you had to escalate. You explored the stressor, there is no stressor. So, how you will correlate? I mean, how you will find the cause to convince her?
Maybe you have some stressor, maybe a hidden stressor, like you are engaged in a lot of activities in your life, and you don't have any time to rest. Maybe you may have some time for recreation, for friends. Maybe doing this, maybe talking therapy can help you also.
Yes.
Find
Talking
out,
with
yes, find out those hidden stressors أو hidden, let's say, يعني sometimes hidden stress is a very nice term الصراحة, إنه something you don't know that it is overloading you. So it is something you don't really look at it as if it's a stressor, but actually your body is loaded because of it. That's why it's giving you some alarming signs, just to take a moment, sit with someone, talk about them, and allow others to help you. فكلامك جدا مظبوط، إنه نحن أحيانا ما بنفكر إنه في عنا ستريسور، بس اللي بيجي بيشوف جدولنا بيجي بيشوف برنامجنا عادي ممكن يبكي علينا يعني. طبعا مو أنا، حد تاني. اوكي اوكي. فالمهم انه انتبه على موضوع الستريسرز، انه it's not always something the patient will share it with me. And
Mhm.
at the same time I can ask her, are you handling the home alone? حتقول لك yes. How many children do you have? 2 ولا 3? Are you taking care of them? Yes. Are you working? Yes. Full time ولا part time? شتري full time. طبعا هدول history question but they are allowed، لأنك بعد ما تخلصي حتقولي لا I can see that you have a busy schedule, you are overwhelmed with a lot of work, and that's why we really need to sit together, especially with a professional person, to help you manage and minimize. تمام. So your
yes.
body can tolerate, your body can cope. تمام. فالcoping mechanism it increase tolerance. الريلاكسينج تكنيك. you are totally right by using those terms بتخلي السيناريو more professional. ويعني كتير صاروا يبطلوا هن أحيانا يعني يجيبوها صعبة، ما تقلك إنه yes doctor I'm too much stressed. بالعكس هي معصبة لأنها حاسة إنه
Mhm.
كل واحد عم بيقول لها إنه أنت stressed وهي ما أنا شايفة حالها stressed.
Mhm.
فهذا من الأسئلة الصعبة. وممكن كمان سؤال تاني، صح، وأحيانا الكحول والدايت والunhealthy lifestyle. تمام. يعني she's having sedentary lifestyle, she's having unhealthy diet, she's drinking alcohol too much, plus hidden stressors مثلا. All of them can together aggravate the symptoms, prevent the good control. تمام. مهم كمان نقول للبيشنت إنه you need to take an active part in your management plan. يعني لازم فهم المريض هالجملة هي إنه don't ask your doctor to solve your problem. Whenever it comes to functional disease, the patient should take an active part or active role in the management plan. You should work on your symptom. You should rearrange your life. You should try to minimize load. So these things have to be done gradually by you, and we will help you. We will support you. We will be there to guide you. فنحن secondary plan، لكن انت كبيشنت البرايمري بلان. فهي كمان لما بتفهميها للبيشنت ببطل يلومك، اعملي لي سي تي، اعملي لي كولونوسكوبي، طب ليش عم تعطيني هذا الدواء، طب علي لي الدوز. فانت لو رميتي الكرة بملعبه من البداية وعرفتيه انه هذا الكايند او type of diseases it's a kind of patient centered يعني patient centered approach، بتعالج بالpatient centered approach، وإنه patient which means the patient should play an active role in his management plan. There is nothing much medically can be done. تمام. Because we cannot give a medication or do some procedure to fix anything. Everything seems reassuring in your workup. It's a kind of functional error or miscommunication between your brain and your gut. So this need from you to help yourself to come out of it. فمتى ما مثل ما قلت لك حطيتي الكرة بملعب المريض كمان هذا بيسهل عليكي إنه he don't argue too much. فهدول من التكنيكس اللي كتير حلوة، بالذات إنه الfunctional disorders become like هلأ من جديد دكتور بورا فاجأني جاية non cardiac chest pain، هي تعتبر functional disease. من زمان إجا الجلوبس hystericus، انه البيشنت الاندوسكوبي نورمال، الباريوم سوالو نورمال، السبيتش السول تيم ريليزد البيشنت، يعني they are telling انه everything is fine، ما في neurological symptom، فبليز patient is for discharge sit and talk with her husband. فهذا كمان disease. الفايبروميالجيا كلها functional disease. you need some professional let's say way انك to deal with the. ما عاد صاروا مثل زمان يقول لك والله am I mad ويعصب عليك، يعني بتغيرت كتير يعني مثلا بالنون كاردياك سيناريو كان too much different عن اللي نحن متعودين عليه. تمام. ف take care of all the concerns بالذات بالfunctional disorder. don't practice السيناريو as usual انه I have a stressors و am I mad doctor you are not believing me. طبعا هي you are not believing me is a very good يعني very good concern، لأنك immediately you should tell the patient we are taking all your symptoms seriously and we are here for you and to find a solution for your symptoms, and we never underestimate the worries and the concerns of our patients. We always take them seriously and we try to solve them and to help our patients come out of their suffering. فبدك تحاول تفهم المريض إنه ما في شيء اسمه I'm not believing him ولا I'm underestimating his pain أو his symptoms. و try not to use the word normal. أنا ما ركزت إذا أنتوا استعملتوها. functional disorder are real disorder و they need a treatment. ف always mention your results are reassuring. تمام. يعني whatever workup was done is reassuring that there is no structural issue. There is nothing obviously abnormal in the general appearance of your organs or of your brain or of your gut. Everything look normal or everything look reassuring, but we are concerned now about the function. Okay, so I have a concern أنا مثل منا and I have a concern of the function but the structure is reassuring. فكلمة normal is making structurally normal, functionally normal. take care don't use the word normal لأنه irritating which will make the explanation more difficult for you. فهذا اللي حبيت إني أضيفه الصراحة. سامحوني لو طولت عليكم.
No, it's okay.
Okay,
Thank you,
thank
Dr.
you.
Hind. For the point also, why you are here, where is your consultant? I believe you can say I had chatting with him about your condition, and you can tell I am here on behalf of him to have a discussion with you, and he will be back soon with you. Don't be panic whenever you have unexpected answer or unexpected or attacking sentence like why you are here. So it's a stressful one, and the exam itself has stress. How to overcome these stresses? By training. Always be tough. Yes, I advise the surrogate to be tough as much as possible, because in the exam the surrogate will be more tough, and he doesn't care about your performance. He want to fail you, and this is instructed by the examiner, by the way. And they don't care whatever you do, you address, you convince. It's not matter for him. Okay, so please, yeah, train on these things. Be hard and be tough as a surrogate. Hopefully we can be much calm in the exam.
Okay.
وبعدين في شغلة حلوة إنه أنتي متوقعة، يعني من زمان ما كنا كتير نتدرب بالطريقة الصح. ما كان
Mhm,
في حدا يمثل حقيقة إنه دكتور I don't want to talk to you، ولا يبدأ فورا يصرخ علينا قبل ما نقول له can you please tell me how much do you know. هلأ لاحظت البراكتس صار أحسن، فتراي to get
mhm,
used to it. try to take a deep breath. انت هلأ ما حدا عم بيحاسبك ولا حيضيع عليكي أي شيء بالحياة، فتراي إنك تستمتعي to feel
mhm,
how to be confident at the
mhm.
time when the surrogate is expecting you to be the يعني to bring
Irritated.
up your weakness. يعني
Yeah.
السيروجيت فكر حاله انتصر وهي will bring up your weakness، فأنت
Mhm,
لا تستمتعي to feel how much you can be confident in this situation. فيعني انبسطي إذا أنت لقيتي اللي عم بيتدرب معك حاول يحطك بموقف محرج، فأنت حاولي إنك تستخدمي terms قوية، حاولي
mhm.
إنك تخلي نبرة صوتك واثقة، وحاولي إنك تحلي الموضوع بطريقة تحسسي السيروجيت إنه يعني I can cover
I
my
can do it.
consultant. Yes, I
Yes.
can do it. I can handle we are here a team, and I can handle the conversation. And if there is anything you are not satisfied about, we can call the consultant later on. He's now busy with something else, maybe more important, ولا with other critical patients. فتراي always to يعني handle it as if إنه أنا كنت متوقعة هذا البرفورمانس.
Yes.
لأنه كل ما بتعملي يعني كل ما بنكون بهالطريقة، كل ما يوم الامتحان مستحيل إني انخض.
Mhm.
أهم شيء إنك أنت أو يعني اللي عم يعمل performance بالذات الفيميلز، إنه بننخض نحن أكثر من الميلز، فحوجهها للفيميلز إنه ما يبان عليك إنك أنت عن جد انخضيتي أو ارتعبتي، أو إنه يا الله ليه هيك بدا السيناريو تبعي. تمام.
Dr. Hind, the opposite, Dr. Hind. You are, as a surrogate, very aggressive. I faced it with the daughter of a ICH patient. She was very aggressive and, mashallah, too much tough, and she never hesitated. Try to convince, she never hesitated. Yeah, the
ريمين لما
one.
بتكون السيروجيت از فيميل قصدك صح؟ يعني لا
Yes.
لأن وبعدين ما شاء الله عليهم بيعرفوا يبكوا. أنا برأيي الرجال صعب عليه كتير يبكي. يعني
Yes.
عم نعيش الدور دكتور بس عم نعيش الدور.
Exactly. Yes. Okay, thank you, Dr. Hind. I think also females can irritate the female more than the male. Or, sorry, you as a female, you can calm down the female. I think so, but we can't, because you are weak for us. You are weak, or we are weak against you. That's why if she shout or if she was aggressive, I cannot calm her down.
مرة قبل ما تحاول إنك تواجهها حتى لو بنبرة واثقة من دون ما إنك to confront، بس you will be too hesitant إنه عن جد ما تقوم تعصب
Exactly.
زيادة وهيك.
Yeah.
كفيميل يمكن إنه تتعاون معنا شوي كونها شايفة إنه الكانديديت قدامها فيميل. وأحيانا لا، بس إنه بشكل عام فعلا الفيميل كسيروجيت بحس إنه يعني حتمشي على السكريبت
Yes,
بحذافيره للأسف.
exactly.
أما الميل قد ما قالوا له كون أجريسيف ابكي مثل عميل، ما بحس إنه بيمشي على
Exactly.
السكريبت وبيتعاون معهم أو بيكون السيروجيت اللي هن متمنينه. فبيكون
Yes,
محظوظ، يعني بيكون محظوظ الكانديديت أكتر. هي فعلا يعني صعب يقول
yes,
لك والله الميل سيروجيت تبعي كان كتير سيء. أغلب الأحيان السيئين
yes, exactly.
واللي بيعيدوا الكويستشنز واللي بيخلوكي تحسي إنك رسبتي بالكيس قبل ما تشوفي حتى وش الإكزامينر بيكونوا فيميل للأسف. بتضل
Exactly.
بتعيد السؤال، بتضل بتستفزك، بتحسسك إنك أنت ما عم تعطيها إنه ليه. حتى مرة ما بنسى دكتور كان اسمه محمد، كان نسيت المهم اسمه الكامل. يعني لدرجة قالت له بوشه، قالت له why you are holding a conversation if you don't know what will happen with me later on. كان السيناريو الميزوتريكسات والترايميثوبرين، فعم بيقول لها
Mhm,
انه هلا since there is an interaction we will stop الميزوتريكسات to give time for the bone marrow to recover. بتقول له
mhm,
طب what we will do with my joint pain. بيقول لها I will counsel الروماتولوجي اللي هو الجوينت، حرام ما قال جارجونز. I will counsel a joint doctor and the bug disease doctor أو infectious doctor, and together they will liaise how they will manage your medication. قال له عادت السؤال مرة تانية، قال له I will try to get them together and we will bring to you management plan. حاول يغير شوي الكلام. قلت له if you don't know what will be my management plan then why you are talking to me now.
oh my God.
يعني كانت بمطر. لا زلت أذكر إلى الآن حتى نبرة صوته وهو عم بينقلنا السيناريو، يعني من أسوأ الإكسبيرينس اللي ممكن تمرق على شخص. يعني
Yes.
أنا بصراحة من يعني ما بعرف، يعني أما أكون بداله أعتقد يمكن فعلا كنت فقدت السيطرة على كل الستيشن.
Actually, in real life, when you are relaxed or in your clinic, if you face such a situation, it will be like very very hard. So what during exam and stress,
عليك
it will
نور
be horrible.
حتتلبكي وتحسي حالك إنه أنت
Yes.
يعني مالك قدرانة تعبي
صح
الطاولة اللي أنت قاعدة عليها
صح صح
يعني.
صح. مم.
فعلا، وانه بدك تقومي تجيبي حدا تاني وتلبكتي
صح
بحياتك.
صح
هذا
صح.
كلام مضبوط الصراحة. فعلا على أرض الواقع وقت بتحسي إنه أنت you are not giving a final answer، ولا يعني you are not the consultant to finalize المانجمنت بلان، فيو يعني وشنا بيحمر وبيصفر فما بالك
Mhm.
فيه.
Yes.
الامتحان صح.
ف it was
But as you mentioned, it's
bad
better to
surrogate.
experience it
Yes,
like
as
yeah
in the
while
practice.
practicing. Yeah.
Yes.
So yeah, that's good.
You might be more professional in the exam if you do it before.
Mhm, mhm,
Agree.
Yeah. Thank you, Dr. Hind and Dr. Najla. Let's move on to the next scenario.
mhm,
Mr. Jones, 68 years old, collapsed a few days ago, came to the emergency room diagnosed as aortic stenosis, and
mhm,
it's very severe. The consultant decided to do TAVI,
mhm.
transarterial, vi-
Trans. Mhm,
trans, transcutaneous aortic valve implantation, right? Yeah.
mhm.
Task: explain the diagnosis, explain the procedure, answer patient concerns. So it's a procedure.
Okay.
If you're ready, Dr. Najla, we can start.
Uh,
Dr. Sarah, you're here?
Yes.
Okay, let's start.
yes. Okay.
Okay.
Here you go.
Hello.
Hello.
Hi, I'm Dr. Sadiq. I'm one of the doctors covering today. May I confirm that you are Mr. Jones, 68 years old?
Yes, doctor.
Yes. Hi, Mr. Jones. So today I would like to discuss with you about your condition, and I'm happy to answer all your concerns. How this sounds to you?
Okay, doctor.
Okay. So, Mr. Jones, just to be on the same page, can you please tell me how far you know about your condition?
Okay, doctor. Suddenly I collapsed in my home, and
Mm-hmm.
this was a couple of days ago. And my family get me to the emergency, and
Mm-hmm.
they do some tests for me, and also tracing, scanning, and
Mm-hmm.
I need to know what is going on.
I understand, Mr. John. I got the result of your scans, and I'm happy to discuss with you about your condition. But do you have any special concern or any particular things that you are worried about?
No, just I want to know what is going on.
Okay, okay, Mr. John. So, Mr. John, your condition, your investigations been reviewed by a team of doctors, and the consultant is, and they diagnosed you as having a condition called aortic stenosis. Have you ever heard about this before?
No, doctor, what this mean?
Okay, so Mr. John, let me draw for you. If this is your heart, and in the heart there is four, we call it chambers, and there is valves um, in the large vessels that carries the blood. So there is this, if this is a great vessel that carries the blood from your heart and distribute it to your body, to the brain and the rest of your body. So this large valve is called the aorta, and there is a valve here. The large blood vessel is called the aorta, and the valve in here, in your condition, is thickened and stiff for a lot of different causes, but in your condition it is stiff and thickened, and that's why it is difficult for the blood to go from your heart through this blood channel and distribute the blood all over your body, and that's why you develop this the symptoms that you have before coming to us. Am I clear, Mr. John?
Yes, doctor.
Okay, so this condition, if not treated, unfortunately, it might lead to a lot of serious conditions and complications.
Okay.
Um, so if this is stiffened or thick valve not being treated, it might lead to your heart will be it will be difficult for your heart to pump the
So
blood.
it is serious, doctor? It is serious
Yes,
condition?
if it is not treated, Mr. John, it is serious
Okay, so
and
what are
have.
you going to do?
Okay, let me explain for you the complications if not treated before, Mr. John. If you are happy
Okay.
to
Okay.
listen to me, so it might lead to uh, like difficulty of your heart to pump the blood through this vessel. So to treat the condition, you need to have a procedure to fix this valve, like a surgical operation.
Okay.
Are you following me? Yeah.
Yes,
So
doctor.
yeah, so this procedure called transcatheter aortic valve implantation, we can call it TAVI for short. Don't bother the medical term. I can explain it for you in a simple way. So it's done through a catheter, like a small wire, and the wire will be inserted through a blood channel from your upper limb or your lower limb. The blood channel, this small catheter or a small wire will go through from the small vessel in your arm or your lower limb. It will go through the blood vessel, and it will guide a new valve to be put in place in the affected valve. Am I clear, Mr. John?
Okay, doctor.
Yeah. So doing this procedure through a wire, it just it had a lot of benefits, being with a minimal intervention. Um, it will be like a kind of quick procedure. Within a couple of hours it can get we can get it done, although it still had some side effects could be expected. Are you
Okay,
following
like
me,
what?
Mr. John? Mm-hmm.
Yes, like what?
Like what? So as any procedure, it might cause some pain, but we will give you numbing agent so you will not feel pain. It might cause some bleeding, but we will revise your medication and make sure that you are not taking any medicines that can increase the your blood thinning, making your blood thin. And we will keep you under follow up afterwards. So just to make sure that the valve is working well, and you are not developing any complications. How this sounds to you, Mr. John?
Okay, doctor. So you say it is better than open heart?
Yes, yeah, actually, it is much better than doing open heart surgery because, as I mentioned, it's just a small wire with a little numbing
Okay,
agent, yeah,
okay.
and it will go
For
through
how
the.
long I, okay, for how long I will stay in hospital?
Mr. John, after doing the procedure, we'll need to keep you for follow up under our supervision for a little time, and it depends about how you will be afterwards. But I wanted to reassure you that most of the people who had this procedure, we will be having a good response to it, and they will not need to stay for long in the hospital afterwards. So we'll keep doing, you will have some uh,
Okay,
investigation
okay.
and
When I will return to my full physical activity?
so yeah, that's really good question, Mr. John. So most of the patient will have a very good quality of life just few weeks after the procedure.
Okay,
You can return to your baseline before the procedure is straight in just a little time.
okay,
Mhm.
okay. And about driving, when I can drive?
For driving, Mr. John, I'm not quite sure about the exact timing, but we can we can discuss with the DVLA, and they can discuss with you exactly when you can
2 minutes
return
left.
Okay,
to
okay.
driving.
About
And if you are happy, I can try to find out for you the exact timing when you can resume
yes, please. Yes, please.
driving.
Okay.
Yeah, I'm happy
About
to do
six.
that. I come back to you afterwards. Yeah.
Okay.
Mm-hmm.
About six. How when I can have my normal life?
As I mentioned to you, Mr. John, most of the patients will go to their they can have their baseline within few weeks, but we will advise you to take it easily. Like we would not like you to exert yourself heavily during exercise or even sex straight away. If you can just give yourself some time, but whensoever you feel like you are okay, you can do it.
Okay, doctor. And
Mm-hmm.
okay, I'm a businessman and I need to travel. How when I can travel?
Okay, Mr.
Hello?
John. I think when you feel, again, I'm not quite sure, Mr. John. I can check for you about traveling.
Okay. Okay.
Okay.
Okay, doctor.
So yeah. So Mr. John, do you smoke?
No.
Yeah, that's great. Do you drink alcohol?
No.
Okay, that's good. So yeah, Mr. John, I can give you some leaflets about the procedure and how it can be going on, and how you can take care of yourself afterwards. And it will contain a lot of details to go through it, and you can learn more. And just feel happy to contact us at any time, and we would like you to sign a consent for the procedure if you are agreed with it. How this sounds to you?
Okay,
Okay, doctor.
time's
Okay.
up.
Thank you.
Okay.
Before starting
Oh,
comment, I will give her full mark for this drawing.
Thank you very
oh.
much.
How you
But
did it
then,
on the screen? Oh my god, the first time. So, so you can draw, right?
yes, you can draw.
Yes.
Mm,
Okay,
Yes.
good. So we can use it
Mhm.
for the next scenarios. And you
yeah.
drawing from the start till the end.
Yes,
You
just
enjoy the drawing, mashallah. Okay.
Mm.
it's easier because the patient is just like, and I finish explaining everything, and she the Mr. John wants to fly and wants to run and wants to
Yeah,
dive and
I
Yes, a lot.
also, yeah,
everything. What is this?
I clap hand for Dr. Sarah. She addressed a lot of concern, which is very important.
Okay,
Really,
yeah.
yeah, very nice session between you and her. Okay, let's hear the comment from Dr. Sarah.
Okay, okay. First, you did well. I thought you will forget the consent because you talk about it after 10 minutes, but you at last you remember it. Okay. First, okay, this TAVI, which is transcaster aortic valve implantation. هي بس شوية some comments about the procedure.
Mhm.
We can first talk about the benefit of this procedure, that it will help you this decrease symptoms, and also it is better than open heart surgery because no cut in your chest, and also no putting on this heart lung machine, and also you when you return to your normal life, that will be very soon. Okay, you said this. Second, we will start by using a guide wire, um, using caster or stent tube on guide wire that will be put through the groin or the neck veins. Okay, the groin blood channels or the neck
Dr. Sarah, if
blood
you
channel.
want, yeah, sorry for interrupting you, but
No.
I guess she said a lot of jargons in this.
Really?
Yeah.
Mm.
Yes, the veins, the
Oh yes.
valves. Yes.
Valve is
Okay.
not a jargon to my understanding, but I'm trying to say uh like blood vessel, or no, sorry,
Yeah, blood
blood
vessel
channel.
is not.
Gate.
Yeah.
I
Yeah,
think it's a gate.
it's
Gate.
yeah.
Valve is a jargon. No.
Valve, yeah. So
Okay.
gate and blood channel.
Some people say
Yeah,
it is
and
a
the
gate.
upper arm, lower limbs, upper limb and
Okay.
lower limb. Yeah. So it's arm and leg. Simply arm and leg.
Oh yes, it's almond leg. Okay,
Yeah.
and then this caster or this then tube will proceed till reach to the valve, and the drawing was good really. And when it reach the valve, it will expand. We will put the new valve to expand inside the old valve.
Mm-hmm.
Okay, and after that, we will monitor you. All this procedure will be monitored, and also will numb the area and clean it before, and it is done under local under numbing, and not you will not go to sleep. Okay, you will be awake. It could be some some staging, but it will not be so painful. Okay, and if you feel any pain, you can tell anyone of the team. Okay, okay.
Mm-hmm.
After that, we will keep you for follow up for about 1 or 2 days. Okay, and we will when we are sure that you are okay and this new valve or gate is functioning well,
Mm-hmm.
then you can go home. Okay.
Mm-hmm.
Okay. To when to return to your physical activity, it soon as you can, as you can when you go home, you can start with light walking, and within 2 weeks, most of the people resume their normal activity. Okay, for the driving, you need to not drive for 4 weeks, but no need to tell the DVLA. Okay, okay. الكلام ده this comments from natures. I will
Yeah,
put
yeah, yeah.
I can put the site. Okay.
I agree. Yes, I agree as well. Yes. Go ahead.
Okay, okay, but avoid sex till the first follow-up meeting. We
Mm-hmm.
can reassess you. After that, you can resume your life. About traveling, 1 week after the procedure, but also I advise you to delay this until the first follow-up meeting.
Mm-hmm.
Okay. Also, in the early period, the first week, stop or avoid strenuous exercise because this will be better to avoid this in the first week. Okay.
Okay.
Okay. Dr. Nagla, she did it well, and she answered the concern, and even the ones that she didn't know, she answered in diplomatic way.
Mm-hmm.
Uh, I think this is very good for her.
Yes.
You can put the marks. I cannot I cannot
Yeah.
put marks.
No, it's okay. Feel free, Dr. Sarah. We are learning.
I
To give
And
cannot
you.
do this. I cannot do this.
Okay,
so,
let me. I
mhm.
will jump. Okay. For using jargons and a lot of jargons, you have to learn how to use simple words. So I
Yes.
can give you borderline. Okay. We have to be some tough here, but better than in the exam. For the clinical judgment, yes, I agree. For some point, also to learn about. So the fly, yes, it's diplomatic answer, but DivLA will not be interacting in such scenarios. You can tell her you can tell him you can stop driving until next meeting or after first follow up. Um, at least 1 month. This is for any acute state, and this procedure it's like major procedure. So I guess also 1 week is okay for holding the driving. Okay. So again, as for the clinical judgment, it can be like borderline, but the concern and the welfare will be full mark. So yeah, yes, two borderline, two satisfactory. The consent also was in the clinical communication. You did it.
Mm.
However, you have to learn about and how to use simple or non-jargon way. It's easy. Try to make it easy while like you are talking to a friend, not to in a medical team or a medical field. So don't use any of the anatomical explanation like upper limb, lower limb, blood vessels, any word you feel it's medical, try to put it in simple or to translate it to simple words.
Yes. I need to practice more.
Yeah, it's okay, and you can do it
Mm-hmm.
by yeah
Mm-hmm.
frequent practice. Okay,
Yeah.
I guess this marking will be fair for you.
I agree. It's okay. I'm
Yeah.
learning.
But
So,
yeah, although the drawing was amazing, really, I like the way you draw. But
mm-hmm.
try to avoid the jargon. So, like you are drawing, yes, but in a
Mm-hmm.
simple way, how to you can say the valve like a gate in the heart,
Mm-hmm.
the chambers. You can say spaces of the heart,
Mm-hmm.
rooms of the heart.
Rooms of the heart. Yeah. Mm-hmm.
Yes,
Mm-hmm.
a blood vessel. It's a blood channel.
Yes.
Yeah, as I said, legs and arms,
Yes.
catheter, and you can say, yeah, catheter. It's like a tube or yeah, I think small tube and or plastic tube in
Yeah.
the
Wires.
stomach.
Wire is okay, I think.
Wire. Okay.
Mm-hmm. Yeah.
Yeah, that's it.
Okay. So just, Dr. Sari, just to clarify, you mentioned for driving,
Mhm.
you should stop for 4 weeks without informing Devali.
Yes,
Yeah.
yes.
Okay. And for flying, it is
1 week.
1 week.
1 week, and
Oh,
better to stay to the next follow-up meeting. That will be better.
Mhm.
and when is the next follow-up meeting? Next week?
The team will the team will decide.
Yeah,
Okay.
always don't give a firm time. So you can say
Yeah.
next meeting, we don't know when I
Uh,
will resume my activity after the next meeting. Also, you don't
we
give
can discuss.
a
Mm.
time, yeah, or yeah, set time for the next meeting.
Mm-hmm.
Try to make it in this way, like diplomatic one,
Okay. Okay.
and always put it in the next assessment. You don't know what will happen. He might be deteriorated after the surgery. He might have a complication. So you don't know what will happen in the future.
Yeah, it's more convincing.
Yeah,
Yeah.
it's yeah makes sense or more to say like this. We don't have proper time, but however, most of patients, as Dr. Sarah said, they are reassuring. They are going back to normal within few days. However, we have to see you again in the next meeting and to have a look to you, to your file, to your monitor. Like this, be try to be away from the clear cut off in any answer for duration. Okay, this is the general advice for any duration. Doctor, when I will die, when my father will die, when I can regain my activity, when I can do driving, when I can fly. If you don't have a clear and sharp, sure answer, don't give him a sharp timer. Okay, So you can say,
Yes.
we can assess you again. I can go to my senior. We can have a meeting again to update you about. This will be more diplomatic without mistake. But if
Yes.
you have sure information, definitely you can say it. What I understood from driving in any acute state of MI, stroke, at least it's 1 month. I will use this in any acute presentation scenario. 1 month for MI, 1 month for stroke, 1 month for major surgery, hemorrhage. 1 month, and we will reassess you back. I will not allow you again to drive, but I can reassess you after 1 month. Or you can say after a few weeks, or you can say after a next meeting, as Dr. Sarah said. Okay? If you are not happy with 1 month. But if you are sure about 1 month, you can say it. If you are not sure about it at all, you can say, well, after the next meeting, after reassessment, after checking you up again, and so on. I agree? Oh. Okay, again, well done, Dr. Sarah and Dr. Najla. Any question from others? Any comment?
There is question about heavy
Sorry?
driving. Question about heavy driving.
Okay. Heavy
In this
vehicle?
scenario,
Mm.
he is businessman, so no need. But I don't know exactly when for heavy good driving.
So again, we can say after next meeting, and I think Divla here also the same for the own car. Anyway, if you are not sure, you can say for the next till the next meeting, you can stop driving after assessment and so on. But what I know, it's longer than the own car.
Yeah. Yes.
Like in the epilepsy, for example, 6 months for the own car, and it will be 1 year for the heavy vehicle, and according also to the disease. Anyway, don't go through it. No one will know exactly for how long the heavy car or heavy vehicle will be hold. Uh,
You can say I will see the DVLA rules because it keep changing.
exactly,
So I
yes.
will see it and I will update you.
I will
Yeah,
check for you.
yeah.
Yes.
DIVLA, by the way, DIVLA, you are referring to the DIVLA for the chronic disease like the retinopathy or multiple sclerosis, myasthenia, something having long-term vision affection. So he will inform DIVLA by himself, and he will have the roles for DIVLA, even the hypoglycemia attacks and so on. But for the acute state, no need to inform DVLA as long as your patient will be back to his normal vision. It's not nothing in the vision itself. Okay, something affecting his general situation. So DIVLA, they are concerned about the vision disease, particularly, or chronic disease might affect the vision or might affect the consciousness while, like syncope attack also while sitting. But the acute state, no need to refer to them. You can review the DIVLA rules, then you can update him. It's a good answer.
Okay.
Okay.
Mm.
Inform DVLA. Dr. Sarah wrote, if driving large vehicle, bus, inform DVLA. You mean for acute also? Yeah, anyway, I
Yes,
think it's
for TAVI, because in this is they started to bring in scenario bus driver. So I think he 4 weeks not drive, but no need to inform the DVLA if you are driving a car. But if you are driving a large vehicle or bus, you should inform the DVLA
okay.
for TAVI only.
Yeah, because it's longer time. I know. Yes,
Yes.
Oh,
it's not just. Yeah. So,
I,
sorry.
I, I have a question about the consent for the procedure, as the details of the scenario doesn't contain clearly to take the consent from the patient or surrogate. As the first or second issue, if the consent is included, mm, she didn't mention details of consent. You can withdraw from the procedure
Yes,
whenever
you're
you
right.
want. Yeah, for I think I think the performance without the consent is lacking, passing the scenario in the real exam. Or what's your opinion, Dr. Bas?
Yes, I agree. The consent, it's not necessary to be written. This is the first question. Any procedure, any starting of medication need to be consented, like chemotherapy or something for long-term monoclonal biological, something need to be consented. You have to get a consent, even they didn't mention have a consent. Why? Because this is your task in the scenario. The task is about big tube. Do you think you will explain the big tube without getting a consent? This is in the real life even. You have to get a consent, right? Whenever you explain at the end, this is the consent form, please read it. So not necessary to be written there, have a consent at the end. And as you said, the steps of consent, always read the consent carefully. And any inquiry, please, you can ask me, and at the end you can put your signature. I agree to put the full steps of consent once you explain the consent. But if you don't have time and you explain the consent, it's better than ignoring the consent. For example, if she didn't explain the consent at all, she will be deducted in her marks.
يلا يا عبود يا عم سيف.
But this is better than not explaining the consent at all. You got it, doctor?
Okay, thank you. Yes, I got it. Thank
Yeah. So any procedure, make it a habit. Any procedure, draw and get a consent. Draw and get a consent. So you have your paper. The paper you will go through the scenario, the station with. Write in your scheme. I will draw. Okay. Or you can draw like simple or light draw outside just to follow the dots of your draw inside. Make like croquis. Then when you go inside, draw in it again. It's okay, just to remind yourself. And at the end, write the consent. You can add also at the end or beside the draw the complication, as Dr. Najla said. The complication is very important here. The bleeding, the failure, the injury, everything you have to mention before and during and after. She managed the time well, by the way, Dr. Najla, in this scenario. She did the timing good. But only missing here the consent, as Dr. Said, uh, like you have to mention if I have withdraw, can I withdraw? Yes, you can withdraw anytime. Just read it and sign it after you finish. Okay. Any other question or comment? The most important legal issue here, yes, I think, yeah, consent, it should be informative consent. Yes, I agree for this. Okay, if no question and
I
any,
just want I added only in the comment regarding the traveling here. If he has the transfemoral TAVI, he shouldn't drive for 1 week. If he has subclavian or transapical, he can drive 2 weeks. The other things about TAVI, I just want to ask. TAVI is a procedure, as you know, the procedure for Wolff Parkinson, the ablation for Wolff Parkinson White. So I think they use a catheter. They use a contrast. So we can say also about the complication of the contrast. The patient might have, they might give you a contrast. They may have allergy to that, or no need to say that. This is my first question. The other things I need to add it for, I think for this patient, he need to be aware to tell his dentist when he has any dental procedures that he has TAVI, because they might give him prophylactic antibiotics.
Okay,
yeah,
about
yeah,
the contrast,
Yes.
they didn't say about it as regularly it is done. It may be done, but
Okay.
not in all cases. Okay, maybe we need to do this if we have time, I think. But it is explained like I said. Okay. Second thing about the might be there is infective endocarditis if you have valvular heart disease. But in this condition, there was no. He didn't know anything about the problem. He just
But after
just
he has already a valve
discovered this.
replacement.
it's talking like artificial valve. This one is artificial valve. So she need or patient need to be taking prophylactic antibiotics. This is
Yes.
her push. Yeah.
Yes, this is I read it in the
Yes,
post-TAVI procedure.
if he have a valvular problem, if you have a valvular problem,
But this
he
is a
need to take
valvular problem already. He has aortic stenosis and it will be replaced. So in the further,
without any maybe after that, but
yes, I'm
I
saying
don't know.
after that, after the
Yes,
operation.
I think also after the on the next meeting I can tell because a lot of information in this scenario.
Yes, because I'm not saying yes, you are right, Dr. Nagla, that it's too
Mm.
much in 10 minutes to say all this question, but the patient might ask this concern.
Yeah,
So
if he
I
ask,
think we need to have
yes,
some answers about this
as a
question. That's
clinical
what I'm saying.
judgment, I think yes, it's indicated
Mm.
since it is a new valve. I think also patient will take anticoagulant. I'm not sure if someone cardiologist here can help us. Anticoagulant in TAVI.
I think yes.
Yeah, so it's the same. If any patient will valve replaced or implanted new valve, he will get or he will take the anticoagulant as well as the prophylactic antibiotics with any procedure, especially those the invasive one. Okay, so you're right, Dr. Sarah, but I guess as informations,
Yes,
it's
yes.
less in time. But if we
And
face
no
it,
time for this information. No
yeah,
time for this information. This is secondary after the procedure. The patient
yes.
will be with history of TAVI operation in front of the dentist. He will refer him to or prescribe for himself antibiotics if there is invasive procedure, GI endoscopy.
Hmm.
But I mean, 10 minutes are not enough to explain all of this information, and even advise not to mention unnecessary information to the patient at this moment. Think focus on the scenario, explaining the procedure, pros and cons, adverse effects, consent. No need for speak about the future follow up in other clinic and other specialty. This is
Yeah,
my
I guess
opinion.
also it's okay. You can say it in the next meeting. We can give you more instruction how to deal with this valve and how to deal with this your next plan with the cardiologist or the heart doctor. It's okay to mention it, but in details, I didn't feel it's necessary here in this scenario. Especially the time is bit enough for the explanation of the aortic stenosis and the procedure. So it's, I think, yeah, just make it for the next meeting. We can give you another instruction, or you can say it in one sentence. I will provide you some leaflet brochure website related to the procedure, to the disease itself, and the care for the valve, how to care about the valve. Simply, and yes, you can overcome all these problems or all this debate. Okay, Dr. Sarah? But it's good.
Yes, you are right. Yes.
Yeah, yeah, it's good to know what to do if he ask
Ask.
me because yeah,
Yes. Mm.
you are expected to be asked about anything in this scenario.
Yes.
It might be a concern in any scenario, especially those who staff centers and staff surrogate and examiner. And if you give wrong answer, it will be a problem for your mark. Okay. Any question or any comment else? Only aortic stenosis, no anticoagulant. Okay. Only ASS? What do you mean by ASS? Okay, if you are interested to do another communication, aspirin, okay. Yeah, ASA, not ASS. Okay, thank you, doctor. What about the time with you? Is it okay to do another scenario? It's what? Is it late?
You want to do another scenario now, you mean?
Yeah.
Oh.
Actually, I asked Dr. Sarah to be ready if you are not ready.
Mm.
So yeah, I don't know. You prepare scenario, Dr. Sarah?
Yes,
Sarah.
I have one scenario. Yes.
Okay, let's do it. And
Okay.
I will If we have time, I will provide you another scenario. If no, we can do it in
No,
other
no, no.
days.
I think we can do only one. I will do with you now on this scenario. Okay.
Okay, post it. I will try to start straight away because I know the time is late already. Okay, so your role or Mr. Anders Nicholas, age 22 years, old man who brought into hospital yesterday evening with head injury, sustained when out in the town. He had Glasgow coma scale of 9 out of 15 on arrival into the emergency, and he had 3 episodes of convulsion or vomiting, sorry, all of which improved after out about 3 hours. He had CT head, which was normal, and he was kept in overnight for neurological observation. He is back to his usual self now and is awaiting a review before discharge. When you come to assess him prior to discharge, he brings up another matter with you. He admits that he was involved in a fight with some other men last night, during which he fell and injured himself. But before this, he tells you that he threatened one of the men with a knife. He is worried that this will have been seen on closed circuit television, CCTV, and asks you do not disclose this identity or tell the police about his hospital admission if they make inquiries after his discharge. Your task is to respond to his additional news appropriately and assess Nicholas' suitability for discharge, including giving post-head injury advice. Okay, as usual, Dr. Sarah with the.
Yes.
Okay. Yes, Dr. Sarah. I mean, I can't say what comment about your scenarios. It's
Okay.
yeah, like police scenarios or I don't know. Okay,
Is
let's.
it
Yes, we'll do it.
okay?
Awesome.
So
Yes, Dr. Azhar.
Oh, it's a very, very big scenario. And I cannot read anything. Can you put this scenario in the chat?
Definitely, yes.
I do not know how you can read it.
this is from Rider book. I'm not inventing anything.
No, he mean the writing is small.
Okay.
Okay, I will post it to the WhatsApp group. You can see it.
It's just like a long essay.
Yes, okay. You can see it now.
Okay, let's see.
Mr. Anders
Yes,
Nicholas.
yes. Now,
Okay.
now I. In the exam, so much big scenario they are coming or not?
Yes, it's big. And you feel like the page is full of letters and paragraphs. Yeah, indeed. It's like that. Okay.
Okay, you can continue.
Okay, you can start, Dr. Sarah.
So you are ready? Okay.
Okay. So let's start. Hello.
Hello.
I'm Dr. Mukhtar, the doctor in the unit today.
Hmm.
You must be Mr. Nicholas. Anders Nicholas.
Yes, I'm Nicola, your doctor.
Okay, you are 22 years.
Yes,
How can I call you today?
Nicola.
Okay, Mr. Nicola. We are here to discuss about your health issue. How do you feel now, first of all?
Yes, I'm feeling very well, doctor, and they told me that I can go home now today.
Yeah, and are you okay to have this discussion?
Yes, I'm feeling very, very well. Thank you, doctor, for all you did to me.
Yeah, you're most welcome. And be sure that this meeting is confidential between me and you.
Yes. I know that. That's why I'm happy that I'm talking with you now.
Yeah.
Yes, yes, doctor. I'm feeling well, but I just want to know if I can go home today or what. They told me
Yeah.
that you can go home today.
Yeah, but before going home, can I ask you what's you know what's ongoing? What happened with you?
Yes, what happened yesterday evening? I was with my friend celebrating a birthday, and we had some argument, which has been ended by become physical. And I came to the hospital with my head injury, and they keep me in the hospital. But I think they told me that everything is okay now, right?
Yeah, I can reassure you that everything is okay. Uh, but I will give you some instruction, Mr. Nicola.
Hmm?
But before that, so what's your expectation about what's ongoing? Are you feeling yourself much better?
Yes, yes, doctor, I'm feeling better.
Oh, okay. You have any concern so far?
You told me, doctor, that everything is confidential, right, in the hospital, and I know that you are keeping everything for hospital confidential, right?
Yeah, yeah. I appreciate feeling that.
Okay.
And be sure that everything will be between me and you.
Yes, so I just want to disclose something to you, yes, that I'm concerned about, and I want you to help me with that.
Yeah, sure. Here you are.
Yes, so yesterday, what happened is that while we having this battle with my friends, I
Uh-huh.
threatening one of my friends with a knife, but he hurted me and put me let me fall on the floor.
Mhm,
And I'm really worried what happened after that, because at this time there was CCTV camera in the road, and I think they might capture that I was threatening him with a knife.
mhm.
So I want you not to tell the police, please.
Okay, Mr. Nicola, I appreciate sharing this with me. And again, I'm reassuring this meeting is so confidential. However, can I know if you hear about your friend, any news about him?
No, I didn't hear about him anything, but I'm afraid that he might complain about me, and also the police will ask you about more information about me and details.
Okay, but he's not injured. You just threaten him, right?
No, I threatening him, yes, with a knife,
Uh-huh.
and then I felt on the floor after that. But I'm afraid that this could be taken, because last year also I have an event with the police, because I having domestic violence with my ex-friend, and they suspend me. I receive a suspended sentence at this time. So I'm afraid that the police, I have a record already, and I have a case with the police. So I'm afraid that also this will affect me. And this police takes this very seriously and can affect my future. So
Yes.
I'm begging you not to tell the police.
Okay. First of all, appreciating sharing this with me. And secondly, I can reassure that whatever you told me about is confidential. However, I can give you some advices if you can go by yourself and just to introduce yourself to them and to be sorry for what happened, and that will you will be free. How do you feel about that?
So you mean I can go by myself to tell the police that?
I only suggest that. However, if you have your insurance or your lawyer, you can go to him and also have a talk with him in order to be protected. Well, I'm not sure about these political issues. Anyway, again, you can talk with some of lawyer or your insurance company about this issue, but be sure that we will not disclose your information to anyone.
And if the police came to ask you about my details about me, would you tell the police? I know that doctors are not allowed to tell the police because patient confidentiality, are they?
Yeah, I appreciate again your request. However, since you are sharing this with me in a confidential way, I cannot tell. But if you tell them, just let me know to be in the same page. How do you
Okay.
think about that?
Yes, that's really helpful. You assured me, doctor. Thank you. I'm really happy about that.
Okay, Mr. Nicola, you have any other concern?
No, I don't have other concern. Yes.
Okay, so Do you know where are you now?
I'm in the hospital.
Yeah, and you know what time we are in?
It's 8 o'clock.
Okay, good. Can you name your any one of your family member, your
Yes,
brother or your father?
yes, my mother is named Jenny.
Okay, good. So I can give you some instruction about the head injury you get yesterday.
Yes.
Yeah. First of all, in the next couple of days, please don't sit out alone in a house. Be with a company in order to be observed by someone. Is that
Okay.
okay?
Yes, yes.
Yes.
And what you can anything that you need to be aware about it?
Yeah, yeah, I want you to be aware about any loss of awareness or abnormal movement, shaking in the body, or feeling unwell. Okay, please don't hesitate to anyone of your family member to call us, or you can come to us immediately, or to call the ambulance without hesitance. How does that sound for you?
Okay, yes, I will do that.
Okay, next or secondly, if you are going to doing some hobbies, please don't go alone, especially swimming. Don't close the door outside while you are in the bathroom, or don't lock the door, in order also to observe or to find out anything might happen while you are inside. Might be dangerous for you.
This
How
is
does
for
that
for
sound?
how long I should do that?
Yeah, I appreciate this is a valid concern. We will update you in the next meeting with our nerve doctor or nerve surgery doctor when you can be free and you can do your all activity or your hobbies without some observer. How does sound for you?
Okay, okay, I
Okay,
will
do you
do.
drive, Mr. Nicola?
Yes, I'm driving.
Yeah, yeah, temporary as well. You can stop driving and we'll update you if you have okay to drive again.
Okay, okay, I'll do that.
Okay, what's your job?
I'm work as accountant.
Okay, and you drink alcohol
Occasionally.
and you're not exceeding the limit.
I know I'm not exceeding the limit, but sometimes when we have a party as yesterday, we drink a lot. Drink about 5 units per yesterday.
Yeah, yes, good to know also about that. And again, I advise you not to drink alcohol heavily in the next couple of days. Yeah, sometimes you know the alcohol might make the head injury worse. It might lead to also subabnormal movement, which is called seizure. It might happen easily after this head injury. I mean,
Mm.
shakiness in the body.
Oh, okay.
Okay, do you smoke, Mr. Nicola?
No, I'm not smoking.
Okay, good. You have any concerns so far?
Less than 1 minute remaining. No, I don't have any concern. Thank you, doctor.
Okay, so I can provide you this information in a paper, leaflet, brochure, and website you can read about. And again, please don't stay alone. And I will give you the emergency contact number in case you need any help. Don't hesitate to come to us. You
Okay.
have any other concern?
No, thank you, doctor. That's really helpful.
Okay, thank you.
Okay. Uh,
Yes, go ahead.
2 minutes. You approached the patient well regarding the head trauma. You
Yeah.
reassured him that you need to be under observation for 24 hour, 48 hour. Don't be alone. You need to be observed. You did the very good things by telling him you need to be observed, someone with you. So this was very good in the scenario. But the
Yeah,
issues,
that's the issue for
yes,
police, yes.
yes, this patient confidentiality, you won't tell the police, but if the police, so at the beginning, when he will tell you, yes, everything will be confidential unless there is harm to yourself or to the others. So when he will start to disclose, okay, you can tell him in a straight way that this is a medical professional and we need to, if we have a legal duty to assist the police. in the investigation of the crime. If the police ask us to have more details about the patient, so we need to disclose that. So you will explain to him frankly. So if the patient didn't mention in the scenario one admission that there is a knife involved or gunshot involved, but if he says that from the beginning, the police will be involved. They will tell the police to be involved. But if he disclosed to you, so you will tell him. For me, I'm not judgmental on you. And if you believe that you did so or you did something which is the police can interfere. So if the police ask me, this is my legal duty and my professional to help the police with that. But what and he will tell you if you will tell the police I don't want you to tell the police, and he might try to threaten you. So if they try to make it like this, the scenario, so tell him we are accepting zero tolerance towards threatening. So you couldn't threaten this stuff. If the patient become more angry and the scenario went in this way, and you need to stay calm and firm. So I think only in the scenario, this patient, you won't tell the police. But if the police ask about detail about the patient, so you will disclose it. So you'll explain it to him frankly. And the other things, you don't need to tell him, I will tell the police. So you'll tell him, I need a second opinion, so I will involve my consultant and we'll discuss about this. And we won't tell, if there is no suspicious or no one ask, we won't tell anything. But if the police ask us about your details, we need to disclose it, because this is illegal, our legal duty. This is all the scenario.
This is
about it. Yes. This is patient confidentiality, but you need to breach the confidentiality. This is the way
not
between
medical issue.
Yes, breach patient confidentiality with the police, with the court. If he has HIV and he's harming other people, yes. But I think this is only the scenario. It's not. We don't need to tell. We will tell the police or anything. The examiner only want to know that if the police ask, you will tell. You will consult your senior and you will tell. You won't do it alone, and this is our duty to do that. So you will explain for him this. But you did it very well regarding yes, you should tell the patient you need to, I will give you follow-up after 1 week with the GP to check for any symptoms, and give him the alarming signs. At any time you have vomiting, you notice any weakness of your body, shakiness of your body, you should call A&E or go to the A&E or call 111. So you will tell him all these things, but you did it well. So the only thing to be aware about the medical confidentiality.
Okay, so the marking, it will be affected in the clinical judgment or clinical communication?
No, I think
confidentiality.
I don't know. Confidentiality will be under which one? I think
no, it's under the clinical communication. Yes,
clinical communication, but
clinical
judgment.
You said already it's not a medical issue.
No, it's not. No.
So it's clinical communication. Clinical judgment related to the head injury and the advice.
Yes, it was satisfactory. The patient concern, you address all the patient concern. The patient doesn't have any concern.
Yeah, it was only concern. Okay.
Yes, and patient welfare. Yes, you did it well. So all of them, but I think only the message from this scenario to understand that the patient confidentiality. Because this scenario, we might face it in the normal. So I think, so we have breach confidentiality according to the DMC if notification of certain infection disease, birth and death registration. In legal cases, when you need a court or if you have any court or any case that you need to disclose, okay. So you don't need to tell the police. You won't call the police and tell them. No, if the police ask, you will tell. Okay, this is the only thing. Okay?
Yeah, I agree. Yes. Thank you.
And if the patient try to threatening, because when you say if the police will ask me, I will tell them. So he might say, I told you not to tell the police, and if you tell, I think this won't pass easily. So if he tried to make that, you will say, I'm sorry about what you are feeling, but I just want to tell you that threatening here, we couldn't tolerate any threatening between the staff. So in a polite way. if the patient make like this. But this
Yeah,
is
and he will stab me and everything will finish.
no, nothing will happen. And you will document everything. You will
Yes.
document everything and finish.
Yes, I will tell him everything documented in the file, and I'm so
Yes.
sorry if the
Yes.
police ask about this, it will
Yes.
disclose.
Yes, it will be disclosed. This is the issue.
Yeah, good to know. Thank you, Dr. Sarah, about this police issues and police cases. I don't know.
I didn't know. I read this scenario and I think.
No, I like to do new scenarios, really.
But this is when I see it. It's
Yeah.
about breach confidentiality. I say, for me, I didn't know to tell the police or no.
How to do,
When I
yes.
read it, I think it's good information to know that we won't
Yes.
tell the police, but if the police
But if
ask
the
us,
police ask.
we'll tell.
Yes, perfect. Yes.
Mhm.
Okay.
Sarah,
Perfect, Dr. Sarah. Yes.
Dr.
I go
Sarah,
to
can you share this book in the group?
It's
Yes,
a rider
okay.
book.
Yes, Rider.
Rider. It's from Rider.
Yeah,
It's
right.
Rider. Yes, this is Rider.
This is complicated.
But I'm bringing Rider from the end, not the first. I bring the last cases.
I never read Rider. Okay,
Yeah.
let's see.
No,
Yes,
it's
yes, yes.
nice scenarios in Rider, by the way, and
Mhm.
the topic as well. It's
Yes,
different scenarios, different categories. Yeah,
yes,
and they are explaining well, by the way.
yes. Okay.
Okay, thank you, Dr. Sarah, again.
Welcome, Dr. Beth. Welcome. Okay, thank you.
You have
I
case, yeah.
think Rider, many scenarios are coming in the exam from the Rider book.
No, I think it was old style or old format, but they are bringing similar scenarios, but it's not like Rider book scenarios.
So it's better to read once, huh?
Yeah, have a look, and almost we did most of those cases. If you review,
Yes, yes. Most of the cases
done already.
we did it then, but I
Yeah,
think at the end they bring some cases that not coming. That's why.
yeah, weird scenario.
Yes.
If you know, Dr. Azhar, there is organ donation, end of life, palliative, all this in Rider, and I think we cover a lot of them. Also explaining a disease, counseling about medication, and they are changing the disease or changing the medication according to the scenario. That's it. But the topic itself, the same, all topics in Rider.
Oh, okay.
Okay, but those scenarios like police scenario, fighting, insulting a nurse, this scenario characteristic in Rider. You will not find it in another book. I mean,
There is a one, my opinion or request. Can
yes,
we
sure.
start at 10 p.m.? Is it possible for you or not?
I tried, wallahi, I'm trying it, and every day I'm trying it, but it's difficult for me. I'm so sorry for that. Wallah. I know it's late for most of us. That's why also I'm recording the sessions. But before I was putting it 10:30, but it wasn't good for me. Sorry for that, wallahi, Dr. Azhar.
No problem.
It's
No
not
problem.
suitable with me. Yeah.
Because I'm always sleeping at 11,
I
10:30.
know, wallahi, I appreciate all of you waiting for this session, but for me also, wallahi, yesterday I slept 2 a.m. I wake up at 7. It was lacking time for me to sleep, but this is the only suitable time to do. And if I do it in 10 or at 10 earlier, I might miss or maybe postpone some sessions. So I prefer to be regular daily and at the same time, not better than missing day or skipping a day. You got it?
Yes, sir. No problem.
Because
Go on.
sometimes I go out or buy something from out or coming from the hospital. So what's suitable for me? It's from 11 afterward. And I'm trying to make it shorter. It's not longer like before. It's just one scenario from both. Okay. Sorry again, Dr. Azhar.
No. You are welcome. You are doing a lot of for us
Thank you,
without
Dr. Azhar.
any,
I,
without
I
your
appreciate.
personal interest.
I
You are helping us.
appreciate it. Thank you so much. I appreciate Wallahi. Thank you.
Well,
Thank you, Dr. Azhar. Any question else, please? I know this session was long, but we learned a lot today. Okay. If no question, we can end the session. See you tomorrow, inshallah. Thank you, Dr. Najla. Thank you, Dr. Sarah, also Dr. Sarah Ghanim and Dr. Sarah. We'll see you tomorrow, inshallah, in another day. Long clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.